Hey there, YouTube fans. How you going? Hey, this video is long overdue. I'm going to speak about, are your estrogen levels in men too high or too low? Now, I'm going to read from an article from T Nation, www.t-nation.com, and let's see how we go with that. So estrogen in men is a lot lower, of course, than in women, and noticeable symptoms of high estrogen. Increased abdominal fat. So if you find it easier to put on weight, loss of muscle mass, low libido, decreased erectile function, tiredness, increased fatty tissue around the nipples, depression, emotional disturbances or irritability, I've noticed, lower urinary tract symptoms associated with benign prostate hypertrophy. What have I noticed personally with high estrogen? As I said, irritability, and my hands fill up with fluid, both of them, and I put on weight, and it's fluid retention. That seems to happen in me. I also put on weight. It seems a lot easier, and it could be the fluid, but it can also be fat. Now, if it goes too low, noticeable symptoms of low estrogen in men. Decent erections, but ho-hum orgasms, they say. Joint cracking or soreness. Fatigue and depression. Blunted emotions, feeling flat. Possible weakening of adrenal glands. Anxiety. Yes, I have definitely experienced that. Fatigue and anxiety I definitely have with low estrogen. Excessive jealousy, that's interesting. Low blood pressure. Excessive urination. The other thing, let's just go back to the high estrogen. For me personally, I've found high blood pressure and high blood sugars, especially in the morning. It affects my blood sugars. And this is what I'm going to try lately. Something's going on with me as far as the high blood sugars and the high blood pressure. I could have high estrogen at the moment because I'm not taking aromasin, which is an aromatase inhibitor. It's an estrogen blocker. Exemestane, I think it's pronounced. So I'm going to have a look at taking half of my aromasin, which is 12.5 milligrams. I don't think I've got it in front of me. Every 4 days, like I used to do. The thing, though, is that I'm on TRT, testosterone replacement therapy, every 12 weeks with Reandron. It's a testosterone undecanoate, however you pronounce that. It's a long-acting one. You only get an injection it's between 10 and 14 weeks most men are supposed to go. The endocrinologist has got me on it every 12 weeks, and it seems to be okay. So I'm not sure if taking half a tablet of aromasin every 4 days is going to be too much, and I'll crash the estrogen. So this is why I'm doing this video for my own use as well. Now, there are lab ranges from 2 years old to 80 years old, if I summarize this part of this document. And I can put it on the screen for a second, if you can see that. But you'll see that the range really is between 20 and 30. They say picograms per milliliter is a healthy range for men to aim for. So that's what they're saying. I've heard that many, many times before. How to get tested. Now, this is the problem. Here in Queensland, they're doing these normal immunoassay tests, I think they're called, which are designed for women, and they can be out by 53% apparently. Now, I've never got this done, and I should get it done, and I will try to get this done in the future. Is you're supposed to order a sensitive assay test. Now, they've got here some of the lab codes, so it depends on which lab you go with. They'll give you the code. So labs should instead use liquid chromatography, mass spectroscopy, which is much more accurate when measuring hormone levels. There's specific lab codes. I'll put them on the screen for a second. So you see there, if you want to pause the video, I'll try to keep that still for you. For example, Mayo Clinic's there down the bottom, LabCorp. So now these are all American labs, but in Australia, well, in Queensland, we have QML, and apparently QML does a sensitive assay. And I had a discussion with pathologists in the past, and they said to try to get your doctor to request a sensitive assay, the test that teenage girls use that don't have a lot of estrogen. That's the way they told me to ask for the test, if that helps anyone. I'm going to try and get that test done. I don't know which doctor's going to help me with that. Maybe my endocrinologist might help me with that. So that's what I can tell you. Hopefully I mentioned that low estrogen as well has made me pee a lot, and dry you out. You lose weight, which is interesting, but to be too high or to be too low is not a good thing. It's bad for your health. You need estrogen in men, for example, even for making good bones. We need it. So anyway, hope that helps somebody. This information, it seems hard to find. This is a little bit of my experience with this article. This article seems to be about right. I've looked at other articles, but with anything, of course, always check with your doctor. I'm not your doctor. Just another poor soul that's on TRT and trying to get these estradiol levels right. I did do research as well in the past about with men, and it seems to be like aromasin. It goes down when you take it, and then it takes about 3 days to come back up. So this is why some people say take it every 3 or 4 days, to get it back down and go back up, go back down, back up. But it can be really easy to take too much or not enough. You have to go on lab values, really, if at all possible. That's the only thing I can advise you. I don't know if that will cost you money. Anyway, it's a tough one to manage. The more body fat you have in a guy, that tends to produce more aromatase, which is that enzyme. I believe it's an enzyme that converts testosterone into estrogen or estradiol. And the more fat you have, especially around the middle, the more prone you are to making high estrogen. So what can happen is you can have testosterone replacement therapy, and then you have this high estrogen levels after a while, and you say to the doctor, I feel terrible, like my testosterone replacement therapy is doing nothing. And that can happen because your estradiol level goes through the roof. You see, it makes the testosterone ineffective. Okay? That's all I got today. Hope that helps. T-Nation was where I got that information from. Remember to like, comment, and subscribe. Take care, guys.